It's about getting an agreement between the various groups that are involved in health in a country, get to an agreement on what direction the health sector must move, what is to be done to improve things, how this is going to play out over the long run. So that means it's about much more than just about aid effectiveness. Aid effectiveness is an important part of that discussion. The aid partners are essential partners in that discussion, but it's not limited to just what happens with the aid in the health sector. It's about how the whole of society's resources are put together to move forwards towards a future. There is a first generic lesson, and that is that command and control approaches don't work in the long run, that you have to go to steer a negotiation. If you say you have to go to steer a negotiation, that is something where external partners, where external players can play a role in managing the time. Policy dialogue is something that is based on trust and that requires a long time perspective, and that requires continuity. It can play a role in managing the people, because policy dialogue is very much dependent on who is involved, and we need to build up that capacity, and that is something where things where one can help. And it's in managing the politics, and managing the politics is also something where external players can play a role, and they can play a role because you have to kind of make sure that in the day-to-day political bargaining one doesn't lose track of the long-term perspective. It's not just about what's going to happen in the next 3 months, it's about whether the country on the long term moves towards universal coverage, moves towards primary care, moves towards health in all policies, towards social inclusion. Keeping that discussion on track, that's an important role. Making sure, helping to make sure that everybody participates in that discussion, that is something where you can play a role. Making sure that there are no important issues that get forgotten or that drop off the table. That is also something where external partners can play a role. I would say that the most important thing there is to make sure that you have a very strong factual basis for the discussions that you're conducting at country level. That is to make sure that one talks about reality and not just about slogans. So starting from that evidence base. The second thing is to make sure that you document things over time, that one doesn't lose the memory of what's being done. And the third thing, and that is maybe the most important one, to make sure that you guarantee continuity over time, that you guarantee a long-term perspective, that it's not just an effort for 6 months or for 2 years, but that it is a collaboration with the country that is predictable and that is a long-term collaboration. It's important that when the circumstances are not good in a country to make progress, that one doesn't just cut off the work. You have to bridge those moments until you get to a situation where you can move again. And at that moment, when the political opportunity is there, that you can move very fast. And I think that the example 2 weeks ago, 1 week ago, of the national conference in Libya is a very good example. That is, there is a situation where there is a political opening for launching a discussion on changing the health system. You have to be there at that moment to immediately be able to support that. And that requires a great deal of flexibility to which the global environment is not really used to. So that is something that we have to create.